Hello everyone, I'm Dr. Francisco. I'm live in this Facebook group. This is bite-sized information for kidney and related conditions. We are here to give you some information about certain problems related to the kidney. This is season 2. The second video is video 55. We continue talking about stones. Today is about what are the symptoms and complications from urinary stones. Remember, this video series is destined to help patients, their relatives, or their caregivers to understand better their disease so they can come into better terms with their own disease, and also by knowing more they can take better decisions about their health with their own doctor or with me if they choose me, so they can have less worries and complications. But this group also can benefit other healthcare providers like nurses, dietitians, or any other person that might be interested in knowing about the kidney or how to protect the kidney or prevent other chronic illnesses like type 2 diabetes, etc. Okay, let's start. As I mentioned, the topic today is symptoms of and complications of urinary stones. Some people actually might not notice even the passing of some small stones or gravel through the urine. They can be passed with no symptoms at all. Larger stones can be really painful if passed, or because they can have caused a little bit of obstruction in the urinary tract, and that also can trigger some pain. But if they were to obstruct totally the passage of urine, they can cause acute kidney failure, or in the long run, chronic total kidney failure. When that happens, the patient can develop symptoms of kidney failure, feeling very ill, and as commented, that can lead to permanent damage of the kidneys with total kidney failure in some cases, needing a transplant or dialysis. For that reason, it is pivotal not to leave this matter unattended and aim for prevention of future stones. The size of the stones is actually the main factor that determines if the stone will be passed in the urine or retained. Typically, if the size of the stone is around 0.5 centimeter or less, it is more likely that the stone will be passed. And as I mentioned, there are many people that have passed stones without actually noticing it. On the other hand, stones of around 1 centimeter or more are unlikely to be passed spontaneously. Whilst stones of middle range of size between 0.5 centimeter and 1 centimeter just tend to be a painful gamble. They might be passed or not, but if so, they can be very painful. In this latter scenario, in some cases, medications like tamsulosin can be used to promote the passage of intermediate stones, especially if they are located in a location that facilitates the flow of the stones. If not, it might not. This medication is not going to help. The pain of urinary stones is actually quite characteristic, starting on the flanks and going down to the genitals, sort of following the urinary tract system. And it is called renal colic. It is severe, and some patients can feel ill with nausea and vomiting. Urinary stones can also cause injury to the urinary tract, and patients can have burning sensation while passing urine, or they might just want to go very frequently to urinate, feeling a little bit irritated. They might notice blood in the urine, which is actually the main thing that worries patients when they start seeing blood in the urine. It will be scary for anyone. Fever can occur and typically indicates that the stone has complicated with an infection, which must be treated as well. So that's it for today. Overall, the main symptoms are pain in the flanks or loins that irradiates or moves to the genitals or around that area, and bleeding in the urine that you can see. So if anyone of your family or you at some point in your life unfortunately have something like that, please seek medical advice as soon as possible. Seems not to be any question now, but if any question, you can put them in the comment section and then I reply later. So please remember to like the videos, my motivation. Share the existence of this Facebook group with people that might be interested or might benefit from knowing more about kidney problems. And I'm Dr. Francisco wishing you the best possible health. Take care. Bye-bye.